Welcome to day 11 of ACULIFT Cosmetic Acupuncture Zoom. Today we're going to talk about the general treatment points. For calming, we have the following points. Do 20, PC6, Anmian. Do 20 is the crossing point on the Do vessel with the 6 yang meridians. C of Marrow Point calms the Shen. PC6, the connecting point of the pericardium meridian, calms the Shen. Anmian, midway between SJ17 and gallbladder 20, calms the Shen, calms the liver. Liver 3 and liver 5 against nervousness. Liver 3 is Yuan source point of the liver meridian. Shoestring point of the liver meridian calms the Shen, regulates liver qi. Liver 5, the connecting point of the liver meridian, regulates liver qi. Spleen 10 and bladder 17 for cooling blood heat and purifying blood against pruritus. Spleen 10 is the point for treating disorders relating to the blood, like blood stasis, heat in the blood. Bladder 17 is Bakshu point of the diaphragm, converging point of blood, and a very important point to treat any blood-related conditions. Spleen 10 and bladder 17 are used against allergies and itching, excellent points to cool heat in the blood, good for acne, carbuncles, folliculitis. These are the points used in almost every skin condition to purify blood and skin. Lung 5, sedation, and spleen 9 to descend dampness, a diuretic. Lung 5, Hussey point of the lung meridian, frees the water passages. Spleen 9 is Hussey point of the spleen meridian, resolves dampness of the lower jaw, regulates the spleen, frees the water passages and urination. Bladder 13 and Li4 are used to disperse dampness or increase sweat. Bladder 13 is Bakshu point of the lung, strengthens lung qi, spreads and descends lung qi. Li4 is Yuan source point of the large intestine meridian, command point of the head and face, expels wind and releases the exterior. Bladder 20, stomach 40, and bladder 39 are used to circulate dampness. Bladder 20, Bakshu point of the spleen, resolves dampness. Stomach 40, loop connecting point of the stomach meridian, known as the phlegm point. It helps resolve phlegm throughout the body. Bladder 39 is the lower Hussey point of the Sanjiao, harmonizes the Sanjiao, opens the water passages, and benefits urination. Sedation of Li2, Si8, and Sj10, and needling of bladder 62 are used to disperse heat. Li2 is yin spring point of the large intestine meridian, clears heat, reduces swelling, relieves pain. Si8 is Hussey point of the small intestine meridian, alleviates pain, clears heat, and damp heat. Sj10 is Hussey point of the Sanjiao meridian, alleviates pain. And bladder 62 dispels interior wind. The points to disperse heat: Li2, Si8, Sj10, sedation. To sedate heat in fire and metal elements. Bladder 62 is cardinal point of yang motility or yang chao meridian, which cools the body. Li4, stomach 25, and Sj6 are used to improve elimination against constipation. Li4 is Yuan source point of the large intestine meridian. Stomach 25, front move point of the large intestine meridian, while Sj6 is Jing River point of the Sanjiao meridian, important point to use for treating constipation, moves the bowels. Constipation points Li4, stomach 25, and SJ6 regulates the stools, improve elimination of sebaceous secretions, of emotions, of menstruation. These are great points to create a clear complexion. Lung 1, kidney 10, and spleen 3 are used to improve nutrition and moisture to skin. Lung 1 is front point of the lung meridian. The crossing point of the lung and spleen meridians regulates and descends lung qi. Kidney 10 is Husi point of the kidney meridian, resolves dampness and damp heat from the lower jaw, benefits the kidneys. Spleen 3 is Yuan source point of the spleen meridian, shoestring point of the spleen meridian, resolves dampness, clears damp heat. Lung 1, kidney 10, and spleen 3 is the combination of points used to cool, nourish, and moisturize the skin. Plus, regular drinking of water and nutritious food will bring about metamorphosis of the skin. So this is very good for thin, dry skin. Wind elimination points are GB20 for the head and face, bladder 12 for the lungs, back, and the skin, and SI12 for the shoulder and arm. Gallbladder 31 for hip and leg, Baxi for hands, and Bafung for feet. The points are used symptomatically without much analysis. Employ different methods to disperse dampness from the three warmers. Different ways to cool the body, the similar ways of elimination, and for calming the person. Wind elimination points are used against irritating symptoms like itching, aversion to wind or cold on skin. Treatment for allergic reactions, for example, sneezing, asthma, and urticaria. And it is also used for diseases with wandering or suddenly appearing symptoms like headaches, rheumatism, skin lesions. Needle wind eliminating point in affected area, and if wind heat symptom, like most skin problems, use the wind elimination sedation needle technique. If it is a wind cold symptom, you use the wind elimination tonification technique. Dampness in the skin, use dispersion points, bladder 13 and Li4. Dampness of the lung, use descending points, lung 5 and spleen 9. Master point of the respiratory system is REN 17. If we include the skin, we have 3 lungs. This is very important for skin problems. REN 17 is a dangerous point and should be given subcutaneously. One has to decide which way the needle should point. If it points in the direction of energy flow of the meridian, it will increase the yin of the skin and respiratory organs. And if it points against the direction of flow, it will reduce the yin in the skin and lungs. In local needling, the skin becomes red around the needled area. This shows that blood and energy arrive at this area after needling. Local needling is the method employed to increase blood circulation in areas where there is stagnation and qi deficiency. It is excellent for use in acne vulgaris, cellulite, and where wound healing is poor. Use 15 mm acupuncture needles of 0.20 mm gauge. For acne, insert around 15 needles superficially on the face. The needles should be applied near the acne, just deep enough to stand and not fall against the skin. They are left in situ for 20 minutes. For cellulite, the same size needles are used, but the entire needle is inserted perpendicular to the skin. 10 to 15 needles should be used on each thigh, and left for up to 30 minutes. There is immediate effect from these needles when they are extracted. Skin looks smoother and the affected area even feels lighter. Further improvement to be seen on the day after the treatment. Sedation technique is performed to disperse energy away from the affected area or from one meridian or organ. Needling against the direction of energy flow is what we do in sedation technique. Used on a point that should be needled superficially. Lung 1 is a dangerous point because of its proximity to the lungs, or REN 17, gallbladder 14, lung 7. These are all close to the bone and should be needled subcutaneously at an angle. Have needle pointing in the direction of meridian flow if you are tonifying, against the direction of flow if you wish to sedate. Vibration technique. The needle is first inserted into the point, needle sensation obtained. The needle is then held with as many fingers as possible. Hand is placed on the patient, then needle and hand vibrated continuously for 30 seconds to 2 minutes, depending on how long sedation should be applied. Vibration technique could be done with much stronger twisting, twirling, lifting, thrusting combination instead of light vibration. Purpose of sedation is to remove pain or excess energy and not to make needling so painful that the patient feels nothing else. Once sedation technique has been applied, needle can stay in the patient for 5 to 10 minutes in acute problems, 20 to 30 minutes in chronic problems. During this time, sedation technique can be repeated and repeated again shortly before removing the needle. Dispersing heat technique is simple and effective. It can be performed on any point, anywhere on the body. This will only disperse the heat. If performed on a sedation point, like liver 2, it might send heat to the sun organ, but if applied on REN 12, it will disperse heat outwards rather than to another organ. Therefore, it is a good point at which to disperse pathogenic heat. Insert needle at the point and obtain needle sensation. Then, thrust the needle once with one push through the 3 levels of depth, heaven, man, and earth, and lift 3 times, once through each level. 1 thrust, then 3 lifts. 1 circle of movement, repeat 6 times. The number for sedation. This creates coolness in the area in which you wish to remove heat. This is used when dealing with acne, rosacea, menopausal hot flushes, urticaria or eczema, gastritis. It gives a similar result to that of bleeding. As it is not possible to apply the bleeding technique at all points of the body, this technique acts as a good substitute. Needle can be left for a minimum of 5 minutes or 20 to 30 minutes when combined with other points. Heat introducing technique. This is the inverse of dispersing heat technique. The yang is introduced from exterior into interior at 3 levels of depth. Again, this can be used on any point in the body. Insert the needle at the point and manipulate to achieve needle sensation. Then, thrust the needle deeper in 3 movements. The total depth is decided by the thickness of the muscle and fat in the corresponding area. Lift it to superficial level, not out of the skin, with 1 motion. Repeat this circle of movement 9 times or more in 9 sets. This should create a warm flow in the area of needling. Useful for those who cannot tolerate the smell of moxa. This technique tonifies the yang of the area, meridian, or organ, depending on the chosen point. For example, using heat-introducing method on front mu or back shu points will create more yang in the organ. Using it on tonification point or fire point of the meridian would cause heat in the organ and meridian. Using the technique on a non-specific acupuncture point of energy balancing nature will only warm the area. Wind elimination technique. Wind elimination tonification technique is used in wind cold. Wind elimination sedation technique is used in wind heat. Skin problems are more often caused by wind heat, so sedation technique is frequently used, performed only on wind eliminating points. Combination of correct technique plus appropriate point will bring about nearly instantaneous results. Other local, distal, and energy balancing points can be used simultaneously while using wind elimination point with corresponding technique. Descending technique. Needle technique performed on only one point, spleen 6. It is used to bring down or descend the ascending heat from any part of the body to the lower warmer. This means that heat symptoms are in the thorax, neck, arms, face, markedly less in the lower part of the body. The descending technique is excellent for treating neurodermatitis in the upper body or itching, heat rashes, or allergic reactions manifesting only in the upper body. Spleen 6 descending technique can be performed up to 3 times in the first week of treatment. Thereafter, it should be performed only once a week. The descending technique is contraindicated in patients with low blood pressure, bradycardia, angina pectoris, and arrhythmia. The patient should lie supine for this treatment. No other needle should be in the patient at this time. The rest of the points can be needled later during the same session or could have previously been in and removed. Needle spleen 6 bilaterally, just deep enough so the needles will stand at a right angle to the skin. Stand at the foot of the patient and cross your hands, your right hand against the patient's right leg and the left hand on the left leg, and twirl the needle 6 times. In women, with thumb first up and then down. In men, with the thumb first down and then up. Then, tell the patient to inhale through the nose, swallow once, not to swallow air. Exhale through the nose. The patient should continue this breathing until you instruct them to stop. Push the needle in at spleen 6 as deep as you can without twirling. If you encounter the tibia, you should stop pushing any further. Repeat twirling again at deep level, this time in both men and women. Twirl the needle with the thumb, first downwards and then upwards 6 times. Perform 3 lifts and 1 thrust, repeating several times with the needle becoming gradually more superficial. When needle has moved to a depth where it is just deep enough to stand without falling against the skin, leave the needle to stand for 1 minute. After 1 minute, you should prepare to remove the needle. Instruct the patient to change their breathing. Keeping their hands on their stomach, they should inhale through the nose and exhale heavily through the nose and mouth. Press the stomach in while exhaling. Needle should be removed at the 6th exhalation. It is possible that skin condition may move somewhat towards the skin in the lower body after a few descending treatments, but this will be temporary phenomenon before skin clears completely. It is advisable to warn the patient of this possibility beforehand.